Okay,
Okay, now it's been recorded.
exactly. So over to you.
Hello, everyone. Welcome to another webinar from BMA. We're very happy to have every single one of you here. If you would please leave in the comments where you're joining us from. So, are you joining from Nigeria? Are you joining from Ghana? Are you joining from the UK? Are you joining from Canada? Just leave in the chat a comment telling us where you're joining us, from today. And we're very happy. So, we have Japan. We love to see more people tell us where they're joining from. I'm joining from the UK. Let me put mine in the chat also. I can see Italy. Someone is joining from Italia. Thank you for joining us today. Our speaker for the day is joining us from Canada. Dr. Enayon is joining us from Canada. Plus, we have Onwuneme. Where are you joining us from? We have Alogla. We'd love to know where you're joining us from today. If you can tell us in the chat. And we have Safina. Safina, welcome to the call. We're asking for where people are joining from. So tell us in the chat where you're joining us from around the world today.
Thank you very much. I'm joining from Nigeria.
From Nigeria. Thank you so much. Well, also David, also from Nigeria. Thank you for joining us today. Um, we are gathered here courtesy of the BMA, which is the Black in Mathematics Association. It's a body that was set up to support Black mathematicians, to promote their work, to have you know, discussions like this that can advance our careers, and to also offer support and funding to researchers who need that. So we're extremely grateful to the organization. This webinar happens every quarter, and we always have amazing speakers. We have Alogla also from Nigeria. Thank you for joining us. We always have really amazing speakers who join and share their knowledge. And today we're going to be joined by another amazing mathematician from Canada, Dr. Enayon Sunday Taiwo, and is going to be talking to us today on the part of the sector of mathematics, which is discrete optimization, and is going to be showing us a real world application of math in healthcare and logistics. We're very excited about that, and I'm sure that there will be so much for each and every one of us to learn by the end of this event. So to get straight to it, I'm going to start by reading a citation of him. But before I do that, does anyone have any questions already? Does anyone have anything they would like to add? Is there anyone who is here for the first time, by the way? If it's your first time joining a BAMA webinar, you could tell us in the comments or just unmute and say that it's your first time so we can give you a grand welcome. So is there anyone here who is joining in today for the first time? Alogla, David, Onwuneme, Safinat. Is it any of your first time joining us today? Is it anybody's first time? Okay, then it means we're all family and everyone here has been here multiple times, so that is fantastic. I'm going to proceed and read Dr. Enayon's citation. Dr. Enayon Sunday Taiwo is a tenure-track assistant professor in the Department of Business and Administration at the University of Winnipeg, Manitoba, in Canada. He teaches operation management, data analytics, and introduction to business at both undergraduate and graduate levels. His research focuses on service improvement in healthcare, manufacturing, and disaster management, with key interest in healthcare operations, supply chain management, data analytics, and stochastic modeling. Dr. Taiwo's work emphasizes developing and analyzing stochastic models grounded in real-world scenarios, supported by algorithmic and empirical methods to inform practical decision-making tools. His research has appeared in leading journals such as the Production and Operation Management (FTPT), IISC Transactions and Healthcare Systems Engineering, Journal of Management Science and Engineering, and the American Journal of Emergency Medicine, with additional papers under review in top-tier journals. So please join me today as I welcome Dr. Enayon Sunday Taiwo. Please react with an applause emoji to welcome our speaker for today. And I'm very sure that we will be learning so much. I'm really excited. It's going to be my first time um, being part of an event, a webinar where conversation is centered around the application of math on healthcare and logistics, which are both, you'd agree with me, very, very important part of our society on a day-to-day basis. So I'm very excited for us to learn from him and just get a lot of new knowledge and potentially have people who start to consider new career paths. So thank you so much, Dr. Enayon. The floor is yours. Dr. Enayon, you can also refer to him as Dr. Taiwo. The floor is yours.
Thank you, Toby, for the wonderful introduction. I hope my voice is clear enough and the sound is better at your end, everyone.
It's perfect. I hear you clearly.
Okay. Thank you. Thank you, Toby. And I really want to appreciate the organizer of this meeting for inviting me to speak at this time. I really appreciate this opportunity. I did not take it for granted. Um, my name is Enayon Sunday Taiwo. Today, I'm going to share briefly, I hope I'm brief enough, on some of the mathematics that we use behind healthcare operations management. Specifically, I will focus on discrete optimization and I will walk us through specific examples which I particularly have done in my own research. I'll try as much as possible to simplify this just to ensure that everyone can follow what we have here. I am aware that this is an audience for mathematicians, so maybe first time in many years I'm presenting to an audience of mathematicians, and so there will be some emphasis on the mathematics, and just as the theme suggests, we're talking about the math behind the resilient healthcare and logistics. So just before I proceed, I'd like to share a little bit about myself. Um, I did my first degree in mathematics from the University of Ibadan, and then my second degree from the University of Ibadan. I also had another master's in mathematical sciences from Ames, Ghana, in affiliation with Kwame Nkrumah University of Science and Technology in Ghana. I proceeded to Hong Kong in 2017 to do my PhD in healthcare operation management at City University of Hong Kong. Then 2021, I moved to Canada as a postdoc, and later 2022, I started my position as an assistant professor. So that has been my journey in brief. I wouldn't want to take so much time um, to talk about this. Um, let's start with this poll first, just to have an idea who we have, the set of people we have in the room today. Let's start with the first question. How many people have research interest in applied mathematics? You can just maybe use the raise hand option as well. Yeah, I can. Yeah. Okay. You got two people there. Yeah, nice. Three. Yeah, that's good. Yeah. So the second question, I know about discrete optimization or stochastic optimization. How many people? Yeah, Dr. Dansu. Yeah. Okay. Not so many. All right. The third question, have you used optimization tools before? Yeah, Dr. Dansu. Yeah. And yeah, maybe Tobi or Jayola or okay. And lastly, have you learned about probability theory or stochastic processes before? Hmm. Okay, that's good. Um, so first, I would like us to go through. I'm just going to mention some of the mathematics that we usually encounter in healthcare operations management and which areas of application in healthcare operations management these mathematics are applied. So think about operating room scheduling. Okay. So if you think about an emergency hospital, the operating room scheduling is a resource intensive, high precision environment with high stochasticity. For example, if you have a surgery schedule for 10 o'clock and there is another surgery schedule for 11 o'clock, you're not sure of how long the 10 o'clock schedule is going to take. Maybe it's going to take, you can predict or you can estimate that it's going to take 45 minutes and you will have 15 minutes buffer to prepare for 11 o'clock operation. But this is uncertain. Service time is random. It could take up to 1 hour, 30 minutes. And then you know what happens? The tardiness is going to affect the next schedule and then another schedule and then another schedule and like that. It's just going to destabilize the whole day. So the focus of optimizing operating room scheduling is to ensure that you have a schedule that can be managed despite the uncertainty. There could be complication during one operation, and you have to ensure that you manage this schedule in such a way as to mitigate um, some sort of disruption in the system. Okay, that's one. Two, we are also looking at opportunity to like this is an area where you have a high demand compared to supply. So you have a lot of people waiting for operations. They are not physically waiting, not physically, but they are waiting outside of the hospital, somewhere in their homes for a slot to get an operations done. So you're looking at how can you prepare a schedule that will minimize the wait time for these people. Okay, so these are some of the questions that are answered around operating room scheduling, and most of the um, mathematics that are commonly used, stochastic programming, and here stochastic programming is quite broad, and so and I just prefer to use that because it covers quite a lot of other specific aspects. Okay, so it's better to just call it stochastic programming. And then there is a new development called robust optimization. Okay, so robust optimization is the new concept in mathematics that is being used to better handle uncertainties um, in, in systems. Okay, so here you have an example of a research paper that worked on operating room scheduling. This is not the only paper in this field. So this is a paper talking about stochastic optimization approaches for an operating room and anesthesiologist scheduling problem. Then we have the physician or nurse scheduling problem. The physician or nurse scheduling problem, the whole idea is you have some staff that are good. They are either more productive at certain hour of the day. How do you match those kind of doctors to certain shifts of the day? Because over time, it has been shown empirically that demand for medical services vary all throughout the day. Okay, so sometimes it can be heavy in the morning. You can have a heavy traffic in the morning or heavy traffic in the afternoon, and then the traffic dwindles later on in the evening. So, how do you ensure that you have the right set of staff? How many staff should you have on shift for a particular shift, right? Because you know that the use of your staff is limited. For example, a physician probably have to complete 3 shifts in a week, all right? And so you also have a limited number of physicians. So how do you ensure that you allocate physicians to the right shift to ensure that there is an effective match between the capacity that you're providing and the demand that you are experiencing. Okay, so for some studies that have actually worked in this area, they use example of mathematics will be like a two-stage stochastic programming, and they solve most of these stochastic programming not theoretically, but using some numerical approach like sample average approximation approach. Some of these concepts might be new to you if you have not done anything related to stochastic processes before. Example of studies in this area is from Zaipo et al. 2022, scheduling of physicians with time varying productivity levels in the emergency department. So this paper considered that individual doctor has some level of productivity at different time. Okay, maybe they are more productive in the afternoon or in the morning or in the evening, and so we want to make sure that we assign those that are productive at a particular time to the right shift, that we ensure that demand is well managed. Okay, then we have appointment scheduling. And when I say appointment scheduling, it could be outpatient appointment scheduling, it could be inpatient appointment scheduling. This is the aspect where I did a lot of work, and I'm still doing a lot of work. I will also draw my example from this aspect. So you think about this case for those that are in Nigeria, in certain parts of Africa, this might not be something that you are so familiar with. Usually in America, Asia, some part of Asia, Europe, to visit a clinic, you need an appointment. Okay, so you need an appointment, and the problem with that is sometimes you get booked maybe 30 days ahead or 60 days, like 2 months ahead of your visit, or 2 weeks ahead of your visit, and probably on the day of visit you have an emergency somewhere else, you have to go to work, or you didn't get an off day so that you can visit the doctor, so you're not going to show up. You're not going to show up because this is an appointment, and the doctor probably has reserved the capacity to see you, and if you don't show up, the doctor is losing revenue. Okay, so the doctor is considering that they need to maximize their revenue. Okay, and when we say revenue, okay, don't get it twisted. There are profit-driven hospitals or profit-driven clinics all around the world. Okay, both in the settings where you have universal healthcare. Yes, there are profit-driven clinics. And even for those places that are not profit driven, they actually have a metric that is driving them in the form of profit driven. For example, if a public hospital would have to ensure that their productivity level is high to warrant the money they are getting from the government. And so if they are losing the patient that is supposed to come, the implication is that particular slot, that particular capacity that have been reserved for this absentee patient could have been used by another patient. So the uh, problem is that how do we plan our schedule such that we maximize our capacity, the utilization of our capacity, and while you are focusing on maximizing revenue, one thing that is done, which has been brought from the airline industry, is the concept of overbooking. So if you don't want to be disappointed, maybe you book two people in one slot. So if one person doesn't show up, another person will show up. But what happens if the two people show up? If they both show up, then there's gonna be someone waiting. And if you do that for every slot that you have available, and then you keep on rolling extra workload, okay, from each slot to another, you're just going to generate a lot of waiting queue for the patients. And that's not going to be fine for the patient. It's going to affect their satisfaction. And probably, in some ways, long waiting also has been found to affect the quality of care. So you want to minimize this as much as possible. You're driving at your revenue. You also want to ensure that you increase the satisfaction of patient. So this is the kind of problem we try to solve in this setting. And the common mathematics approach that we usually use involves queuing theory, stochastic optimization. This particular paper described a lot of challenges and the way to approach some of these challenges, some of the mathematics that you can use to approach some of these challenges. So, lastly, I'm going to talk about organ transplant assignment, and these are not exhaustive. So, these examples that I have highlighted here, there are more to it that are being done in the area of healthcare operations management. For organ transplant assignment, the issue you always want to think about is you have people that are waiting for certain organs. Okay, a lot of people, they are sick for, maybe they are waiting for kidney transplants, whatever other transplant they are waiting for. There are limited available organs. Okay, so you have to wait for maybe someone to die who has actually chosen to donate, or you have to wait for a living person to come and donate their organs, right? So for most of the Western settings, it's unlike if you come with a family member that is willing to donate, that organ will go directly to you. But if you don't, and this organ is going to come from maybe a deceased donor, then this particular organ would have to be assigned to patients based on certain rules. Usually, the rules are around prioritization. Say, oh, the most sick person gets the organ first. But the issue is, if you give the most sick person the organ first, and you leave out the less sick person, over time, the less sick person becomes sicker. So, at what point should you attend to this one? While you are prioritizing the most urgent patients? That's one question. Okay, it's a question of prioritization. And then there is a question of fairness there. Okay, so when you move people ahead of the queue, you have to be conscious of the fairness there. Is it fair? In what capacity? How do you justify this approach? And so balancing this is difficult, it's quite difficult. And again, you also want to maximize utility. You want to give this organ to someone who really needs it. Uh, Maybe someone who still probably would have value to deliver if they get this organ. Take for example, someone maybe of age 90 who is near uh, the point of death. The question then is, why should you prioritize this person as compared to a 12-year-old kid who still probably have a lot of years ahead of him or her to do life? So it's not that easy to find a balance between these kind of trade-offs. Okay. So the dynamic programming is one of the mathematics field that is commonly applied in this area. This particular paper is an example of paper working on organ transplant assignment, and they try to develop a model that ensure fairness, efficiency, and flexibility in organ allocation for kidney transplantation. Okay. That said, I'm going to move on to talking about some approach to dealing with or working in this area. If you're a researcher and you want to develop some sort of research agenda in this field, This is a little bit common to many applied mathematics. Okay, so it's nothing unique to this area. So I'm talking about some systematic approach. Okay, so if you are doing applied mathematics, in which sometimes you can also try to translate this to pure mathematics as well. But for applied mathematics, they are crucial. Okay, so you have to start with the problem description. What is the problem in this field? What is the problem in this environment? Okay, what are the trade-offs? If we do this, what is the implication? Why are they not doing it this way? Okay, usually because there are some trade-offs. That's why the problem is complicated. Okay, if there are no difficult trade-offs, maybe the solution should be trivial and there shouldn't be any need for mathematicians to come in and help us solve anything. Okay, so you have to motivate the problem. What are the trade-offs? Then you have to also understand the process layout. And when I say process layout, you have to understand the environment. Okay, what kind of application you are working with. I work in healthcare operations management. Um, Most of my research focuses on um, outpatient clinic. Okay, and when we mean outpatient clinic is more like any facility, any hospital facility that does not admit patients. Admit patient means they don't have facility to accommodate patients that want to sleep over. Okay, no sleepover. It's just like 9 to 5. Okay, you come, you get your service from the doctor, and you go. There's no place to accommodate someone who wants to sleep. So those are outpatient clinics or outpatient hospitals, right? So you have to understand how that setting works. It's this kind of setting is different from emergency hospital. Okay, so you really have to understand how the setting works, how the service process works, because if you don't, you really don't know how to apply what theory of mathematics to solve the problem. And if you don't understand how the process works, again, it's going to show on your understanding of the problem. And if you don't understand the problem, you can barely solve the problem. Okay, so you have to understand the process layout, the service process. You have to understand potential assumptions and decisions that needed to be made, and you have to uh, tune your assumptions to be as close to the reality as possible. But this will come from your understanding of the setting, understanding of the problem. Now, once you understand the problem, you can proceed to doing the model formulation. And at this point, you can draw on a lot of mathematical tools, stochastic modeling, um, some queuing theory, dynamic programming, whatever optimization theory you can think of. You have to apply some probabilistic processes there and develop optimization problem usually. Okay, so there is usually, not in many case, not in every case, some optimization problem to be developed. So there are some cases where the goal is not to develop optimization problem. It could just be a game theoretic approach that you apply. So you have two people playing a game and you want to determine the best strategy that gives one person advantage over the other in the system. Okay. So you go about doing your model formulation, and once you have your model set up, and we're going to go through these steps in an example here. When you have your model set up, you have to determine some structural properties. Okay, you have this model. This is an optimization problem. What can you say about the objective function? What can you say about the constraint set? And all of this you have to determine. Okay, so the goal of the structural properties, why you do this, is to ensure whether the problem is solvable or not. And when we say solvable, maybe analytical solution, like theoretical solution is available, or there is a way for you to get, if you have an optimization problem, is there a way for you to get a global optimal solution or a local optimal solution? So Determining some of the structural properties of this optimization problem will allow you to understand the possibility for solving this problem. And some of the properties that are usually tested include submodularity. These properties are directly applicable under discrete optimization. And I should take some time back now to talk about discrete optimization. So the difference between the general optimization that you might be familiar with, and everyone is actually familiar with optimization if you're a mathematician, I'm sorry to say. It's just the way it is being presented. Right from high school, you do differentiation and how to find the maximum of a function or how to find the minimum of a function. What you're practically doing is optimization. Okay, so when you have a function, you differentiate the function, set the first derivative equals to 0, and find the value of the independent variable that solves that equation. Then you have a solution, what you call the maximum point or minimum point, whatever that is. Okay, what you are doing is optimization. Okay, that is optimization, and that you are working in a continuous domain. Okay? You are working in a continuous domain. Now, if you come to this point where you have a discrete domain, integer domain, okay, you have a function that is defined on integer domain, but takes value in the on the real line, you have a discrete optimization problem. Okay, so that is the difference. So from most of the continuous models that you are familiar with from the high school approach, where you have f of x, differentiate f of x, or differentiate y, dy dx, and all this, there is an underlying assumption there that is not explicitly described in the high school mathematics. So you have a function and you are asked to find the minimum of the maximum of that function. So basically, you just go ahead and differentiate the function. You differentiate the function assuming that the function is continuous. Not all functions are continuous. That's the problem. And it took me quite a lot of time to really understand why we do all this when I was doing my undergraduate program. And we were being taught continuity, differentiability, integrability. And I was like, I don't get it. Why are we doing continuity? Why are we doing differentiability? Because, for example, you have a question that say, prove that this function is differentiable and determine the derivative. Okay, if we're still going to determine the derivative, why are we wasting our time proving the differentiability? Yeah, it took me quite a lot of time, like completely, like I was doing my PhD when I realized this. And thank God I chose this part of applied mathematics because that helped me to actually decipher what we were doing in those pure mathematics. So the problem is not all functions are continuous. Okay, and if a function is not continuous, it's not differentiable. Okay, so you don't just take a function and then go ahead and differentiate it. That's not the case. When you come to a setting like this, you have a function that you maybe it's your objective function. You have to take note. If it is objective function defined on the continuous domain, you have to first check whether the function is continuous. You have to check whether the function is differentiable. Okay. Now, additional assumption that we usually make when you ask students to find minimum or maximum of a function at high school level also include assumption of convexity or concavity. Okay, you always assume that the function is either curved downward or curved upward, smooth. Okay, so that there is a turning point. And so you differentiate to determine the turning point, and the turning point is usually the optimum point, right? That is an assumption we usually make, okay? But we don't explicitly talk about this until you get to a point or a level like this where you have to determine these structures that actually give you the opportunity to go about doing first derivative, set equals to 0, and determine the solution. Okay, so basically I'm talking about convexity. So convex function, not all functions are convex. Again, so for a function to be convex, it has to be differentiable, it has to be continuous and differentiable. And as a matter of fact, it has to be twice differentiable. Okay, so these are some of the assumptions that you have to test first before you apply the existing methods that helps you to determine the turning point. And this applies to a function defined on the continuous domain. For function defined on the discrete domain, there's no possibility of continuity, okay, because the domain is not continuous itself. Okay, so you cannot describe continuity. So that's one. Two, differentiability with respect to the independent variable is also an issue because the domain is not continuous. Okay, the domain is not continuous, we cannot talk about differentiability. So we basically don't have direct convexity as far as discrete domain is concerned. So what we have these other properties called submodularity. Multimodularity is the convexity equivalent in integer domain. Okay, so instead of talking about convexity that we have in the continuous domain, we have multimodularity in the integer domain. So when you're dealing with discrete optimization, if a function is multimodular, it is more like saying the function is convex. Then we also have other forms of properties like lattice convexity, or we call it L convexity, or you have L nature convexity as well. And you can as well go ahead to derive other theoretical results. And in our illustration, we're going to see why we derive additional theoretical results and what you can do with those results. Now you have these structural properties. They describe solvability of this problem. Now you can derive some insight from these structural properties to develop your solution approach. So depending on the structural properties, you can see whether a complete theoretical solution is possible, whether you can solve mathematically for the optimal solution, or you have to develop some algorithms, heuristics to solve this problem. There's also an option of some sort of enumeration methods. So you can enumerate all the domain space, all the feasible solutions in the domain, and test the function on all the points to determine which of this point is optimal. You can also use simulation approach. And now, after applying the solution approach, the final point is to analyze, do some experiments, analyze your results, derive some insights, and some implication for business purposes. Okay, so these are some of the things we do in this area, especially in the area of applied mathematics. So you just don't stop at deriving some nice mathematics. You also have to go ahead and describe how to apply this mathematics to a real world problem that you are solving at hand. Right. So at this point, do we have any question? Let me just take a pause and see how far I'm doing. Okay, go ahead, please, Kazim.
Okay, hello. Thank you for the wonderful presentation. I'm sorry, actually, I was having network issues, so I wasn't completely stable in the meeting. However, I gained one or two things which I want to ask a significant question from, I believe. I make a point where you were discussing about appointment schedules that you perhaps said it may not be common to some of us, especially here in Nigeria. And I actually want to see the beauty of mathematics or the strategy or methodology employed to get that appointment schedules achieved. Though I was somehow familiar with some computer science projects or research that I've been engaging in applications development that schedules patients for medical consultation and the like. So I don't
Mhm.
know if there is a picture or at least the methodology you employed in one of your articles you share with during the course of the presentation. If I can gain one or two things from it, maybe a clarification. And perhaps if you are open to research collaboration in that area, maybe you can share some materials with me that can be of help with the members. But I'm actually interested in that area because I got that point during your presentation, and I think it's a catchment area for me to explore. I'm always open to
Thank
learn.
you.
So I hope you got my question anyway.
Thank you, Kazim. Yeah, I got your question quite well. And depending on what you are conversant with, the next slide, I'm going to start describing, or I'm going to start with a simple problem. I call it simple, it might not appear simple. I'm going to start with a simple problem and walk you through. And you can see that particular problem is just to motivate how we solve sample appointment problems. And I can then I would conclude with some more sophisticated cases. Okay, so yeah, your question, you're on the right track, and that is the next direction I'm going. And after this, if there is still something you want to clarify, yeah, we can catch up. Okay, so let's proceed. So I'm starting with a toy problem. I call it a toy problem, but it is not trivial as you can think of. Okay, so let's describe the problem. Here is a clinic, and every patient that will visit this clinic will require an appointment in advance. So I want you to be open-minded in that there are ideas here that you can apply to other aspects of application beyond healthcare setting. Say, for example, for some high-profile individuals, to see them, you need to book an appointment. Or for certain business partners, to see them, you need to book an appointment. And there are other cases where appointment scheduling is applied. Okay, so the knowledge here can be transferred to those settings as well. Okay, so now let's start with this clinic. We assume that this is an outpatient clinic where if you have to come in, you must book an appointment, and you have to book appointment some days in advance. Now, for this particular clinic, we assume that you have only one doctor. Of course, you can have more than one doctors. So only one doctor, and that is the person that is attending to all patients. So it's not like you come and then they pass you to a quack nurse or something. No, this is the only person that is attending to patients. Any other person is just supporting the doctor. So for the doctor has T appointment slots. Okay, there is a finite number of appointment slots that the doctor can work. And for each of these appointment slots, the doctor, someone will have to help the doctor assign patients to those appointment slots, so that on the day of service, a patient is coming at 10 a.m., another patient is coming at 10:30, another patient is assigned to come at 12, like this throughout the day. So it's not like you just give them a day, everyone come on Sunday or come on Monday. No, that's not what we want to do. We want to ensure that we give people the right timing so that when they come in, they will have to wait lesser time to get to receive the service that they have come for. Like I mentioned before, some patients may decide to cancel their appointment very late. And when I mean very late, maybe few hours to the start of the day, they cancel their appointment, and it will be too late for you to get another patient to fill that slot right away. So for example, I'm waiting for appointment. I didn't get an appointment yesterday, and 1 hour, you give me 1 hour notice to come. It's very hard to find which patient would have the time to come within that short notice. For some, you may find some patients, right? But you don't know which patient would have that time to come within that short time notice. So late cancellation is as good as absenteeism. Okay. So you can have late cancellation or what we call or no shows. No shows, they don't cancel, they don't show up. Okay. So these are possible behavior that you can see in the system. And like I mentioned before, if there are no shows, you're losing revenue. If you're a profit-driven system, you are losing revenue. Or you are losing utilization. Even if you are not profit-driven, you are losing utilization. That particular slot could have been used for someone else. So it's more like you're losing revenue, basically. So to avoid no-show, like I mentioned, airline approach, overbook or double book, whatever you are familiar with. Double book slots. But if you double book slots and more people show up, you get to work overtime. You get to experience long wait time. Patients will experience long wait time. And experiencing long wait time is not good for patients, right? It's going to lead to loss of goodwill. If you're profit driven and I come to your hospital and I have to wait for 4 hours, you give me an appointment and I'm here and I have to wait for 4 hours, maybe I'm going to look for another hospital next time I'm going to hospital. Okay, so that's not good for your business. So you want to ensure that you keep the patient satisfied as much as possible. So how do you balance this trade-off? So the decision we usually want to make is to determine what is the optimal schedule to balance these trade-offs. Okay, so sometimes we make some assumptions that we can readily determine from historical records the probability that someone is going to be a no-show, that someone will be absent. To simplify this particular problem, we assume that for each slot, like if you come, a slot is like maybe 30 minutes long, and that is how long it takes the doctor to attend to one patient. And so that's why we can schedule only one patient or so, but we can schedule more than one patient to arrive at the beginning of one slot. But all we know is that for the doctor, the service time is deterministic. The doctor can serve only one patient in one slot. Right. So that is the description of the problem. Okay. We understand the setting, we understand the trade-offs, we understand the assumption. The decision is to determine what is the optimal schedule to balance these trade-offs. All right. So the problem description is complete. Let's talk about the model formulation. So the model formulation will proceed in this way. Let's assume that X is an example of schedule, and X is basically like X1, they are integer values. They assume integer values. This component of the vector assume integer values, and they are the number of patients that you have assigned to arrive at the beginning of individual slots. So X1 will be the number of patients that we have assigned to arrive at the beginning of slot 1. X2 is the number of patients that we have assigned to arrive at the beginning of slot 2, and so on up to slot T. So this is your schedule. Okay, just assume that this bar here is the way you filled your schedule. Like these are the number of people that should arrive in the slots. But because of no show, the number of people that you realize on the day of service is random. Okay, it's random because you don't know who may not come. You for example, you assign 3 people to arrive at the start of slot 1, and only 1 person shows up. Okay, that's possible completely. So these values, the realization of these values is random. Okay, so now let's suppose that the number X bar T is the number of arrivals in slot T. Okay, the number of realized arrivals in slot T. like this, at the beginning of slot T. This, if we assume that we know the probability of a person not showing up, so it's actually a Bernoulli event. Okay, a person not showing up is a Bernoulli event. You either show up or you don't show up. It's like a flip of a coin. Okay, so one person can either show up or not show up. There's just two events that can happen. There's no in between. So that's a Bernoulli event. So let's suppose you have this Bernoulli event with probability rho. Okay, for individual person, with this probability, they can show up. With probability rho, they can show up. So if you have a Bernoulli event and a Bernoulli experiment, and you repeat the Bernoulli experiment n times, you get a binomial experiment. Okay, and that's basically what is happening here. If we assign 3 people here, an individual person we arrival of an individual person is a Bernoulli event. So a Bernoulli event in 3 places becomes a binomial event. Okay, so therefore this x bar t is a binomial. It follows a binomial distribution with parameter xt. Xt is the number of people we assign there, and rho, which is the probability of sources, the probability of a person will show up. Okay, so that's the way you think about this. That's the arrival process. Now, if you observe the arrival process, how then do you walk through the workload process? The workload process can be captured with what is called the Lindley recursion. The Lindley recursion is a theory in queuing theory. Okay, and this is how it works. So let's suppose that LT is the number of patients that are waiting to be served at the end of slot T. So think about it. Let's go back to our schedule. We assign 3 people to arrive at the beginning of slot 1. The physician can only serve 1 patient in 1 slot. So if 3 people arrive, what happens? The physician will see only 1 patient, and 2 people will be waiting by the end of this particular slot. These 2 people then will be joined with new set of people that have been given appointment to arrive at the beginning of 2nd slot. Okay, so out of all these people that are packed, the physician is going to serve 1 person out of them. And then you have additional load, right, that you move to the next slot. And you keep rolling like that. You keep rolling loads from one slot to the other. So let's suppose that LT is the number of patients that are yet to be served by the end of a particular slot T. Okay, we can write this process in this form. Okay, LT is equals to the maximum of LT minus 1 plus x bar t minus 1, comma 0. So that's what this plus means. Okay, the maximum of this term and 0, whichever is maximum, whether 0 or this particular term. Okay, LT minus 1 is the load you carry from the previous slot to this slot. X bar t is the new arrival you observe in this new slot. Okay, and then minus 1 is the number of patients that the physician serves in that particular slot. So by the end of slot T, all you get will be this. So let's go back to this table again. So X1, 3 people have been assigned to slot 1. All of them arrives. They serve 1 patient. The physician serves 1 patient. So there are 2 people left. Okay, by the end of slot 1, 2 people are left. Let's suppose another 4 people have been assigned to arrive in slot 2. Okay, so 2 people have been carried over from slot 1 to slot 2, and 4 people, or 3 out of the 4 people that are assigned to arrive in slot 2, 3 out of them arrives. So at the start of slot 2, how many patients do you have here? 5. So you have 5. So the 2 that you move from slot 1 to slot 2 is the LT minus 1. Okay. The 3 arrival you observe in slot 2 is X bar T. So you have 5 people. So by the end of this slot, this second slot, the physician will serve one patient. So 5 minus 1 will be left. So you have 4 people left by the end of slot 2. So this minus 1 takes out the number of patients the physician serves in that particular slot. Okay, so this is how you describe it. And this, because this is not just complicated to derive a distribution for this, it's not just complicated because of the maximum function or operator. It's also complicated because of the random part. This x bar t is random. We don't know how many people we arrive. Okay, this makes it a little bit difficult. But you can usually find a way to derive this distribution. And this is the approach we usually follow, and I do this a lot in a lot of my research. So try to derive the workload process or derive some processes, and then try to capture the probability, okay, the distribution for this process. And so I'm going to show you how to derive a distribution for this particular process. Okay, so with this workload process, we can determine the wait time distribution, all right, because the workload process, for example, at the end of each slot, you know how many people are waiting, so you basically can capture the wait time distribution based on the workload process. So let's suppose pi t of k is the probability that k people are waiting to see the doctor at the end of slot t. Okay, so at the end of a particular slot, the probability that the number of people waiting is equals to k is given as pi t of k. Okay, the pi t of k, we can derive a closed form probability for pi t of k using the linear recursion LT. So this is the way we do that. I'm just going to give you the formula, and then I'll take a little time to describe what we're doing here. So what you have in the first part is capturing the LT part, LT minus 1 part, okay? LT minus 1 part, that is the part. And the next part is capturing the XT bar. So what is the probability? So we want to determine the probability that k people are waiting at the end of particular slot t. So think about it this way. If I see 3 people waiting at the end of this particular slot, it means that at the beginning of that slot, there were 4 people. Because you know that in every slot, a physician can serve 1 person. Okay, so basically, that is what we want to capture here. So at the beginning of that slot, there are 4 people, basically. If I see 3 people at the end of a slot waiting to see the doctor, it is because there were 4 people and 1 person had been served. So if there are k people waiting at the end of slot t, that means there were k plus 1 people at the beginning. Okay, so how can I get k plus 1 people at the beginning of a slot? It's either possible that I have k minus I plus 1 people carried over from the previous slot, and I patient arrives in the current slot. So you add k minus I plus 1 to I, the total becomes k plus 1. Okay, that is the idea. So this part is capturing the probability of k minus I plus 1 people have been carried over from the previous slot, multiply the probability that exactly I patients arrived in this current slot. Okay, and I could take value from 0 to k plus 1 because you don't know how the split between the carryover and the new arrival works. You don't know whether you have to capture all the possible possibilities. Okay, so starting with I equals to 0, it could be that k plus 1 people were moved from the previous slot and no new arrival occurs in this current slot. So when I equals to 0, that's the implication. Okay, and you continue like that to k plus 1, I equals to k plus 1. When you get to I equals to k plus 1, it means that no patient was carried over from the previous slot. All the k plus 1 people that we see at the beginning of this slot, they are new arrivals. So that's how you determine this first part of the probability. And then there is additional term. If k equals to 0, so previously we already mentioned that If I observe K, it means that K plus 1 was there at the beginning. But it's possible that at K equals to 0, if I observe 0% at the end of slot 1 or a particular slot, it doesn't mean that there was one patient there before. Yes, it is a possibility which has been captured in this particular term. But there is another possibility that has not been captured in this first term of this expression, which is the possibility that no patient was carried over from the previous slot and no new arrival occurs in the new slot. And that is the part that is captured here, if K equals to 0. And for K greater than 0, there is no extra term. All terms are captured here. Okay, so this distribution will guide how you derive your optimization problem. Now we have this distribution, and then these are expressions that we have used. T is the number of is the index for the slot. Okay, T equals to 1 up to capital T. K is the potential number for people that can arrive, and K is from 0 to N. And N is the total number of people that have been scheduled to arrive in a day. And probability that zero patient is in the system at the beginning of slot 0 is equals to 1. We have to put this there because you know that at T equals to 1, we have to compute pi of 0. And pi of 0 at 0 equals to 1, and pi of 0 at any other value equals to 0. And F here is just used to describe a binomial probability mass function. So probability that a binomial function, binomial event shows up I successes. Okay, that's what we have here. That's the way I just use that notation. So now I have this probability. I can use this probability to derive some performance measures that are of interest to me and of interest to the providers. So some of the performance measures we derive includes the expected wait time for patients, the expected idleness for physicians. So idleness there, it means in the form of loss of revenue. You know, if a physician is there and the patient is supposed to arrive in the slot and no patient is in the system for the physician to serve, that means a loss of revenue. So we capture the loss of revenue in terms of idleness in the particular slot. Okay, and the expected overtime. So if you have to work over the T appointment slot that you have, then the physician begins to charge overtime costs, you know, and the overtime cost is a little bit higher than what you stand to gain from a patient. Okay, so you have to be careful. You want to minimize your overtime. You don't want to work overtime. That may not be the case if you look at some systems that they don't price fairly. Okay, so we are considering a system that is priced fairly. Okay, so now we can derive the expected wait time using the wait time distribution this way. So the first part of this expression, you're trying to determine the expectation, or what is the expected number of people that will be waiting in a particular slot. Okay, so let's say slot 1, okay, and the total number of people that can arrive, the highest possibility is N, okay, the total number of people that have been scheduled. That's the highest possibility. So you take the expectation over this particular slot, okay, that's the first series. And then the second series, now you add up all the expectation across all the slots. So from slot T equals to 1 to slot T equals to capital T. Okay, so that's what you have. And then at the end of capital T slot, so there are no new arrivals again. So what you have is the carryover from the last time slot that you keep on serving. So if there are, say, J patients waiting at the end of the whole clinic session, so it means that by the end of that, you have J patient waiting. The doctor can serve one patient per slot. So by the end of the next slot or the next time, there will be J minus 1. Okay, so J patient waits, and then You have J minus 1 will wait through the next slot because the doctor is serving one of them. So J minus 1 is going to wait. And then in the next time slot, the doctor is going to serve one patient and there will be left J minus 2. And you continue like that. So this is going to be like a series, you know, J minus 1, J minus 2, J minus 3, up to 0. Okay, so if you have J patient waiting at the end of it, so you're going to have this wait time, you're going to accumulate this wait time in that form. J minus 1 plus J minus 2 plus J minus 3, and so on. So that, if you solve that series, you take the sum of that series, you should get J into J minus 2 over 2. Okay, so that is the sum of the series. Then you can determine the overtime. Okay, so the overtime is just the carryover from the last time slot that you have. Okay, all the possible carryover. So that is the expectation there. And lastly, you can derive the idleness. Okay, so take together the total time you take to work. Okay, so T plus OX is the total time that the physician has been working. And the total number of people that can show up, the expected number of people that can show up is N multiply rho. Okay, so if you think about the binomial experiment, that N people can show with parameter N and rho, the expectation is N rho. Okay, so that's how you determine this performance measure. And using the performance measure, you want to determine the value of X that minimizes the weighted sum of this performance measure. So you have to assign some cost parameter to the weighting. So if the patient waits for one slot, how much does it cost? You have to assign some cost to penalize this system or this action. So CW is the cost of waiting per patient per slot. CI is the idle cost per slot. And CO is the cost per slot, per extra slot that the physician works. So we want to minimize this function. This is the function we want to minimize, this optimization function. And all the possible X must be in the positive integer. There must be vector from t-dimensional positive integers because we cannot schedule negative people. All right, so that is how we formulate the model. And we can derive some structural property. At this point, I think I'm a little bit short of time. I'm going to just rush a little bit through. Like I mentioned, we can show that this function is multimodular, that this function is somewhat convex. Okay, so the description of multimodularity is given by this expression. So I'm going to just move away from this and describe the implication of this later on. So the implication of this is that if a function is multimodular, you can use local search to find the global optimal solution. So if the function is convex in integer domain, you can use a local search to find the global optimal solution. Additional properties that you can also derive is to show that for this particular schedule, there is an upper bound on the total number of patients an optimal solution can schedule. Because the whole, I should first let you know, the implication of this result is that, so if I know the total number of possibility, okay, what is the maximum number of patients that can be scheduled throughout, okay, the total number, I can use that to guide my local search. Instead of searching beyond that maximum, I'll ensure that the vector that I'm searching is bounded by that, the sum of the component of that vector is bounded by that maximum. Okay, so I will limit the feasible space. That will limit the feasible space and speed up my algorithm. So you can, the way to determine N is described here. The way to describe N, to summarize, is to assume that all patients are assigned to arrive at the beginning of the first time slot, okay? And then you don't incur a wait time cost. So you bump all of them to arrive at the beginning of the session, and then you only deal with your idleness and the overtime. So whatever value of N minimizes this function is the maximum possible, because the moment you put the wait time, which is the additional time that that we have left out, the moment you pull the expected wait time, expected wait time is a penalizing term. Okay, so you're going to have something less than N. Okay, so that is the logic there. And this particular expression or this particular problem can be solved completely using theoretical approach, because the only term that is complicated is the term of the overtime period. And that can be derived basically using the binomial probability mass function, that the total number of people that arrive at the beginning of the period is greater or equals to greater than t, right? That's the only time you can have overtime. So if it is greater than t, if it is not, then there is not going to be overtime because you're going to serve t people or less than t people in t slots. Okay. So now we are able to derive these structural properties, and then you can apply global ultimate solution approach like the local search. Enumeration is possible, but that is possible with a very small problem instances. So the local search works in this way. You have to start with a feasible solution, assume a solution that is feasible, okay, X star, and then compute the neighborhood of X star. So the neighborhood of X star is basically derived from the definition of multimodularity. So these vectors are used to compute the neighborhood of X star. So if I have a vector X, I can add this particular vector to it, which simply means I should remove one patient from the first time slot of X. So that's a new vector. Okay, that particular new vector is a neighbor of X. Okay, or I can add this particular vector to it. This add one patient to first slot and removes one patient from second slot, or basically move one patient from second slot to first slot. That is entirely new vector. That vector as well is a neighbor of X. Okay, so that is how we compute the neighbor of X. So this is the illustration from this diagram. If you have X is this dot here, and then you have all these square dots that are the neighbors. So what you're going to do is to search, okay, determine which value of X in this neighborhood minimizes the objective function. That is what we are looking for. Okay, what value of X in the neighborhood of X star minimizes the objective function? X star is just any solution. It's not necessarily optimal. Okay, so, and even when you compute the neighborhood, there could be a better solution in the neighborhood of X star. So determine that better solution, or determine the solution that is that minimizes the objective function in the neighborhood. If this new solution X hash, if this new solution, the objective value of that solution is less than the objective value of your initial solution, then you have found a new solution. Okay, there is a new solution X hash. So you replace X star, which you started with this X hash. Okay, so your X star is now different now. And then you go back to line 2, compute the neighborhood of this new X star, and go to line 3, do the same thing, test line 4, and if you find a new solution, then you assign it to X star. Otherwise, if there is no new solution, then your X star is the optimal solution. You return X star. Okay, so this is the mathematical expression for deriving the neighborhood. So we can solve sample solutions using practice relevant parameter values and determine the effect of changing parameter values. For this particular example, some of the insight include front loading of optimal schedule, basically suggesting that you should have more patients to arrive at the first time slot, so that even if more people arrives, you are probably going to handle them later on when some slot becomes empty in the later time of the day. So that's the logic behind that. And if you are doing overbooking, if you are scheduling more, which you will do to hedge against the no-show, if you're scheduling more, you should reduce the level of overbooking you do when the show-up rate increases. So if the probability that people are going to show up increases, you reduce the level of overbooking that you do. You keep on adjusting your schedule depending on the characteristic changes in your system. These rules guarantee that you are able to minimize wait time and optimize provider benefits. Okay, so the progress, now this is a toy problem. And now I'm moving on to a more complicated problem. So I'm going to describe these problems, and I'm not going to go through the same process as we did before. So for this particular problem, which you can find in this paper we published in 2020, we are trying to see that, okay, apart from using overbooking to hedge against no-show, suppose you allow some set of people to arrive without appointment. Okay, so we call them walk-in. So, but what you're going to do is to restrict what time they come. Okay, so I give you 9 to 10. If you arrive 9 to 10 without appointment, I'm going to accommodate you. If you come outside of that period, I'm not welcoming walking. I'm only welcoming those who have appointment. Okay, but if anyone arrives between 9 and 10 and you have not served them, or you've not served them by the end of 10 o'clock, you have obligation to serve them before the close of your session. Okay, so they can arrive, but they may not get the service within that period, but they are allowed to arrive within that period. So that's what we are trying to look at here, in addition to the description of the problem we have in the toy problem. Okay, so let's add walk-in to it, and let's restrict the arrival of walk-ins. So the question then is, some of the trade-offs are still the same, but additional trade-off that is added is, if you open up 9 to 10, a lot of people can arrive, far more than you expected, and it becomes a problem for you. Okay, it becomes a problem for you. You will have a huge wait time and a huge overtime to do. Okay, so, but additionally, if you have walk-in, you can use those one to cover for those regular patients that do not show up, right? So you have a way to get additional revenue from walk-ins, right? So the decision we want to make is to determine what is the optimal schedule that we should use for the appointment people, and what should be the best time to specify for the walk-in patient. Okay, so that is the goal of this problem. So you can easily extend the toy problem formulation to account for walk-in and also account for restricted time window. And if you do that, for this particular problem, multimodularity still holds, so we can still use local search to solve the problem. And some of the insight we still find in this is that front loading is still somehow evident in this setting. And for the time windows, if you have high no-show, so if the routine patients are not likely going to show up, you know what you do? Use the early hour, open up the early hour for working patients. That's what this solution suggests. But if the routine patients are likely to show up, all you have to do is to open up the latter part of your appointments for arrival of walk-ins. Okay, so basically, you don't want to accumulate too much wait time. The next problem we worked on, and this problem is quite a little bit interesting and a little bit emotional for me, in that this was actually a problem that I learned from a barber shop that I transferred the idea to a healthcare clinic, healthcare setting. So back when I was in Hong Kong doing my PhD, I used to visit a barber. And I don't know if the barber keeps appointment book. I'm not aware of it. The barber is so good. And you come in, if you come in, everyone want to see the main guy in that shop. But he has supporting staff that also can do a good job, averagely. And so everyone comes in and everyone is queuing up to see this particular main guy in the shop. And if you wait for too long and you are tired and this supportive staff is available, you can just let go. At least, I've waited too much here. And I'm talking about 2 hours of waiting. You can wait up to 2 hours if you have to wait for this particular guy. So if you wait for too much, and which is what I do, if the queue is getting too long, I just opt to see the supporting staff. And he will just give me what he can give me, and I'm okay. I'll walk away. So how does this apply in the healthcare setting? For healthcare setting, assume we have a similar setting where you have a doctor and you have a nurse practitioner. A nurse practitioner is not just a nurse. A nurse practitioner is someone who holds a degree in nurse and also holds advanced degree uh, in nursing. Okay, so they are highly trained, but they are not as trained as the doctors. Okay, so people look at them as, oh, the doctor provides higher value compared to the nurse practitioners, though they are highly trained and they are also capable of handling some cases that the doctors can handle as well. But people, just by preferences, people look at them that, oh, if I see the doctor, my case is going to be solved better compared to when I see the nurse practitioner. So we assume that the utility you derive from seeing the doctor is UP, which is higher, and the utility you derive from the nurse practitioner is UN. And if you come in, there is only one appointment book. Okay, so the doctor has the appointment book. The nurse practitioner does not have appointment book separately. Okay, so what happens is that if you come in and you see that the waiting line is too long, you can decide to just, okay, nurse, come and attend to me. Okay, you are free to do that. And the utility you get for, or let's say the satisfaction you get will be UN or whatever you can call this value. Okay, so there is that choice choice component to it. And the way you determine your choice is dependent on your wait time. Okay, if you come in and you're waiting too long, you have to measure your utility versus the wait time, okay, to determine your net utility. If your net utility is higher, okay, if you see a nurse right now, okay, your net utility is higher if you see a nurse right now compared to waiting for additional time to see the doctor. Okay, so you compare that, compare the net utility you will derive if you wait longer to see the doctor to the net utility you will derive from the system if you see the nurse right away. If that, whichever is higher, will determine which provider you're going to see. So there is this pattern of switching kind of in the system. So you are in the doctor's queue, and if the doctor's queue becomes longer and you measure your net utility, you switch to the nurse. You switch to the nurse. So there is still no show in the system, all right? But there is additional complication here. So there is a loss of revenue, the trade-offs. Fewer patients will imply higher underutilization because you have two people working, okay? So you can actually bump up the schedule so that, oh, people will be forced to wait. And if they are waiting too long, they will be forced to use the nurse practitioner. But that is very risky, okay? Because you cannot determine how the patients make their choices when they arrive. It's very risky. So that part you have to be careful. So if too many patients arrive, you are going to deal with long wait time and overtime. So the goal for us is to determine the optimal schedule that balances this trade-off. You have patient choice in the system. You have the presence of a non-physician provider, which is the nurse practitioner. So we cannot readily extend the toy model or the previous model that we did. It's not possible. So we have to develop a new model. In this particular model, the nice property, convexity, or multimodularity is not evident. So we have to develop heuristics, and we still observe some sort of front loading in this system. And what we observe that is a key takeaway is that if we introduce a nurse practitioner into a system, suppose a system exists that does not have a nurse practitioner, we can use the nurse practitioner in the system to stimulate physician utilization, okay? So the idea is if you bump up your schedule, you are guaranteed to have more people to arrive, okay? And if more people arrive, you have an alternative option. They have alternative option. So if they are waiting too long, they can go see the nurse practitioner. So basically, the physician will be highly busy almost every time. Almost every time, because the waiting queue in the physician side is what is driving the next set of people that will go to the nurse practitioner. So you can use that to stimulate more utilization in the system. And additional stuff we also observe is that for this to make sense, the utility that the nurse practitioner is providing must be very good, must be good enough. There should be a threshold, okay? There should be a minimum threshold. So for example, let's go back to the barber shop, okay? Suppose I'm here to see the main guy, and the supporting guy who is here cut my hair, and it doesn't look good. This is terrible. It's really terrible. If I come the next time, I'm not going to see the supporting guy. Never. I'd rather wait in the system for as long as it takes to see the I'm not going to see the supporting guy. Never, because he did a bad job the last time I came. I have to wait for the main guy for as long as it takes. So that is what we're saying here. So the supporting guy will have to provide a certain level of satisfaction for it to make sense. So these are some of the insight we derive from this particular problem. And to conclude, I should let you know that healthcare system is a critical component of our society's safety. Okay, so it's going to be there. We need healthcare system to work properly for the safety of the society. The system, you have to understand, is dynamically changing every time. And so there are new challenges in the system every time, because we are dealing with the human kind of like a system that is managed by human. And even if it's managed by AI, it's still going to, because you are interfacing with people, people's behavior will change over time. There's a way people change and react to changes in the environment. So you expect that there will be problems to solve in healthcare setting for as long as we exist as human. Okay. The truth is that the solutions to these challenges are rooted in fundamental mathematical frameworks. Some that might be existing right now, or some that will be developed in the near future. So be ready. As mathematicians, there are a lot of work, there are a lot of opportunities out there. Artificial intelligence, yes, we are in the age of AI, but the truth is AI can drive up supply of capacity. Like you're going to have more hands. AI is going to provide more hands, either in terms of speeding up for the existing human or creating their own service points to help humans. But with increase in supply of capacity comes additional increase in demand. So demand will also outpace supply. If you increase supply in healthcare setting, you expect that, oh, the system will be saturated with supply. That's not what has been observed in the past. So adding more supply, adding more doctors to the system does not necessarily ease off the system, especially in this part of the world. It doesn't necessarily ease off the system. So if you have more doctors, the speed is high. People who would not have come to the doctor before, they would now come to the doctor. For every slight headache, they will come to the doctor because they know they don't need to wait too long. So they are going to see the doctor. So if you create increase in capacity, you are also going to indirectly going to create increase in demand. And so what that means is that there's still going to be complication in the system, and we still need some math. With that, I come to the end of my presentation, and I thank you for listening.
Thank you so much for that amazing presentation. It was very insightful. We learned a lot, and we're really grateful for your time and the effort you've put in today to be with us. So now we have. Oh, by the way, before we proceed to the question and answer section, can we give our speaker like applause with the emoji? So can we just clap for him to appreciate him for his time and for like the brilliant knowledge that he shared with us today? I want to see more applause beyond mine. Okay, yeah, I can see. All right, thank you. So now,
Thank you.
Thank
Thank
you.
you for having me.
So now we have the question and answer section. So if you have a question, please use the raise hand so that we can call you forward to ask a question. Does anyone have a question today for Dr. Taiwo? If you have a question, I'm going to start calling names. Cousin, oh, okay, Iman, oh, okay, yes, please ask your question. The floor is
All
open for you.
right. Yeah. Thank you so much for that insightful talk. I mean, I have a question. I don't know if it is political or not. But there's this
Okay.
ongoing health issue in Canada about doctor issues, and it looks like you have the solution for them. So I don't know what is the current situation, and what do you think the prospect is? Like, it feels like the healthcare system is somewhat overwhelmed, because I have friends that keep talking about the fact that you cannot just walk into a hospital and get immediate attention.
Yeah. So thank you for the question. Yeah, like you mentioned, it's slightly political, it's slightly operational. So the political side of this problem is that the system is heavily regulated. Okay, so that is the political side. So, like for example, you cannot just come in and establish your practice. You cannot come in and get started with practicing. Or you need to, if you're coming from outside, you need to first get licensed here to work. And the license, again, there is a little bit of fragmentation, which is coming from the political side, in that if you are licensed to practice in a particular province, that license is not valid to practice in another province.
Wow.
Wow.
So it's not easy to move doctors around anyhow. Oh, we need this doctor in Manitoba. Oh, we can just fly one from Ontario. No, he cannot come here.
Wow. That's self-inflicted pain then?
Yes,
Wow.
it's self-inflicted.
Wow.
That's from the political front. But like I mentioned, just adding supply does not necessarily solve the problem. There is that operational side to the issue.
Okay.
So the operational side, which also includes what I have mentioned in my talk, the utilization, so the people's behavior, the patient behavior as well. Okay. So some of the challenges would include, if you assign someone to come for an appointment in this heavily loaded system, and that person is not showing up for his own appointment, you are depriving another person of that opportunity. And that person, that particular person is just going to enter back into the queue. Right?
Wow.
And
Okay.
so it keeps on growing. You keep on growing the queue this way. And it makes it a little bit harder to balance this issue.
Wow.
Yes. So there is also additional operational issue with respect to how facility manage the available capacities. Okay. So you have to schedule your facility or your capacity in such a way as to like maximize the utilization as much as possible. So that is there. And there's also one political side that is also bedeviling this system. The healthcare system here is largely, let's use the word cautiously, free.
Okay.
It's a universal healthcare system.
Right.
It means that heavy pocket doesn't cut it. Okay. So you can be rich as Dangote or rich as Elon Musk. It doesn't mean you're going to get higher priority than me that I don't have money. So everyone waits in the queue. And because everyone waits in the queue, you can go in there without having money. So there are more demands that are created. Because you can easily go in there, you don't have to think about money. So if it's a certain way you have to think about money before you go to hospital, you know the implication already. So that is going to drive down the demand a little bit. So,
but so it looks like removing the bottleneck will solve the problem to a large extent, though. Like removing the
yes,
bottleneck of, so it means there are professionals right now who cannot practice just because they are waiting to be certified or something.
yes,
Wow.
correct.
Okay.
Yes,
Wow.
correct.
Okay, I think my next question, which I think is would be useful for people in attendance, maybe there's someone here, an undergraduate, a master student, or PhD, who is picking up interest in this line of research, looking at its practicality, its applicability in healthcare or whatever. What would be your advice for that their trajectory to get up to this point?
Thank you for the question. Yes, and thank you for raising the question. I thought about this, and I was thinking of
Hmm.
putting this on my slide, but I think
Thank
I
you.
was too
Yeah.
carried away.
Yeah. That's okay.
So if you are undergraduate, depending on which university you are, um, I think the first thing is the passion. Okay,
Hmm.
what are you passionate about? Are you passionate about solving society problem,
Hmm.
or you are passionate about just the fun of solving mathematics problem?
Right.
There are two things. Okay,
Mm-hmm.
and if you are passionate about just solving mathematics problem, the best place to be being in pure mathematics, because there are a
Yeah.
lot of
Just
problems.
enjoy yourself.
Enjoy yourself, you can have fun.
Mhm.
Okay,
Yeah.
but if you are passionate about solving society problem, just think about being in applied mathematics, and
Mm.
whatever the applied mathematics could be, doesn't have to be operations management like myself. It could be in modeling, it could be computing, which other all these areas. So I personally picked this interest uh, in my 200 level at undergraduate, and I consolidated strongly after I listened to um, what do they call it again? That the inaugural lecture from one of our
Okay.
professors.
Mm.
And a professor, very very sound and intelligent person, but he works in the area of pure mathematics, and he went on to list some of these big mathematical theories that he derived, and he mentioned that they can be applied in um what do you call it, cybersecurity, all of these, but there was no single illustration of how to apply this, and I
Wow.
felt like, no, that's not what I want to do.
Mm-hmm.
I don't want to do a math that will take century after I have gone for it
Mm-hmm.
to find relevance in the society. No. So I just decided to consolidate. I came across operation research, math 2 MAT 251 or 253. I forgot what the code was in UI then. And that caught my attention. And that's how I started to look towards that direction. I took probability courses, and then in my 400 level, I took some courses that allowed me um, to pursue specialty in operation research. So I took operation research, I took optimization, I took probability theory. And then when I came back from my master's in UI, again, I specialized in operation research. And it's so sad. My supervisor, Dr. Nwozo, died in 2017, just
Wow.
a few months after I traveled for my PhD.
I'm
He was
sorry about that.
very supportive. He was an inspiration for me.
Mm.
And I remember that one of my lecturers in the department was a little bit disappointed in me because I graduated as the best graduating student in the department,
Mm.
and he thought I should have specialized in functional analysis or this pure mathematics. That going to applied mathematics is for the weaker vessels.
So
Well,
they think.
this is my choice.
Wow.
Okay. So I pursued my choice this way, and I even while I'm doing mathematics, I'm doing something that is directly relevant. So my undergraduate project was around flood um, optimization for flooding, and then my master's level, I did something on multi-attribute decision making. Um, then a similar thing I did. I worked around the fuzzy set and all this kind of fuzzy application at my for my masters in Ghana, and then I moved to Hong Kong to a business school, basically.
Mm.
So for those who are interested in pursuing um, the direction that I am in right now, so few things that I plan to mention is that uh, the specialization you are looking for that is related to what I'm doing can be found in multiple departments. Okay, it can either be under computer science, you can find
Mm.
operation research under computer science, or it can be directly under mathematics department. So I'm saying this specifically just to help some people that might be looking for scholarships.
Mm.
So if you're looking for scholarships and you are looking at math department and you're not seeing what I'm doing, that's because they don't have it there, but they can have it in another department. So you can see it in business school, and it could come under the Department of Operations Management if they have it directly as Operations Management, or it could come under the Department of Decision Sciences if they have it as Decision Sciences. So you take note of this. You could have it under Management Sciences. Okay, so they're all there, and then it could also be under the Faculty of Engineering as Industrial Engineering,
Mm.
either industrial engineering or systems engineering. So you can find this area in all these departments. So
Mm.
they can be situated in any of these departments. So if you are looking for opportunity in this direction.
Thank you
So
so much for the answers.
yeah.
So we have, I've seen two hands go up. I know Kazim raised up his hand. Kazim, do you still want to ask a question, or as Dr. Emmanuel asked, what was on your mind? And there was also a second hand that went up. But I think the person who raised the hand up has left. Um,
There was Damilola too. I think that he has a
okay,
question.
Damilola.
Yeah.
Okay, Kazim, yes, please go on.
Hello.
Yeah,
All
we
right.
can hear you.
Thank you for the presentation.
By the way,
It was
sorry,
very
Kazim, sorry to
insightful.
interrupt you. Kazim, sorry to interrupt you.
Okay.
We're completely out of time. So let's try to keep things very quickly. One question, and then he also answers very quickly, just so that we can also get it over with, and also ensure that everybody gets a chance to ask their question before we completely go out of time. So please go on.
Okay, thank you, the moderator. Quickly, yes, while the presenter was presenting, I saw an equation under the model formulation that defines s as integer. I don't know if you can quickly see the slide. I actually want to just get an insight from it. Under the model formulation, can you please help me to scroll to that where you define x as integers and towards the uh, distribution where you mentioned toy problem exactly. Thank you. Then can I please a slide after this? I mean towards the formulation area. Okay. Yes, yes. I think this place. Yes, I you concluded this place with a distribution called binomial distribution. So I don't know I don't know, but what I actually want to get there is, can I just have some literature reviews that can be shared with us when you are sharing this material with us? Can we have access to it so one can explore more? I actually am interested to see the dynamics in this model. That's why I just put that up. So maybe at the end of this presentation, maybe these materials can be shared with us and one or two references in the area. I don't want to take much time on that, so I just have to keep it that short. Thank you.
Yeah, sure. This is not directly from my paper, but it's just a simplified version of what we solved in my paper. So you can check out my website for this particular paper, or just go to my Google Scholar, type in my name, you'll find most of all my publications. And all you just have to do is just go through, if it helps, or go through the references in my paper, and you would be directed to other materials that also did similar stuff on appointment scheduling.
Thank you, sir.
Thank you. I see Akin Bade also has a question. Akin Bade James also has a question. Please go on with your question.
Thank you, Mr. Tobi, presenter, for a wonderful job. I'm Akin Bade from Nigeria.
Thank you for
Please,
having
I just want to ask a question, that this idea that you use here, is it possible that we call in mathematical model? I want to look at the way I can even incorporate into my own area of specialization, which is mathematical model.
Yes, I think it is possible. Depending on what kind of aspect of mathematical modeling that you want to do. I think Dr. Dansu can help shed more light on that. But I know that even in mathematical modeling, there's optimization part where you want to do some sort of optimization of the system. Yeah, you can actually use the idea. And there are some mathematical modeling problems that you can rather solve as optimization problem instead of solving them as dynamical system.
Okay.
Yeah, Dr. Dansu, you want to provide anything on that?
I think mathematical modeling is really wide, so you really need to narrow it. In fact, every applied maths you do technically is mathematical modeling. If you ask me, is it engineering, like fluid dynamics, solid dynamics? They are all mathematical modeling, but in our realm, right? Most of when we say mathematical modeling, we are thinking mathematical biology, mathematical epidemiology, ecology.
No.
That's what we are thinking about most times. So what yours is epidemiology, right?
Yes. Yes.
Oh, okay.
No.
Okay.
Yes.
Yeah, I mean, I think it's all about, because in operations research, right? You are basically, you are maybe creating appointments, or maybe you are assigning some things to maybe doctors to patients, nurses to wards, and things like that. So if if you can break down epidemiology to assigning something to something, maybe that can also work. So it's all about how the nature of the problem you're solving. So it all depends on that, right? So I mean, more information will be needed for that to be made possible, for sure.
Thank you so
As a
much. We have
As a contribution to that, mathematical modeling is not about epidemiology alone, if it is mathematical modeling. But the challenges we have,
Exactly.
especially in Nigeria, is most schools that teach mathematical modeling, they mainly affiliate it to epidemiologists. I actually have that
Exactly.
challenges during my master's, when I was insisting that I want to do mathematical modeling on security. And my supervisor is insisting I should go into uh, epidemiology. So if I'm going to tell you, that's why it's easy for me to see this. Though I minor in optimization, so it makes it easier for me to dynamically adjust my models and concepts. So in some university like UI, mathematical modeling stands as operational research, even in Unilag. So they won't call it mathematical modeling. In fact, it's going to be it's usually referred to as operational research. So if you're working on mathematical modeling of epidemiology, all you just need is get 1, 2, 3 articles from optimization or specifically on operational research, then you need to help the others to put 1 or 2 things together. So I think, yes, mathematical modeling is wider than epidemiology alone. Thank you.
Thank you. Thank you,
thank
Kazim.
you.
Thank you,
We
Dr.
have
Dan.
thank you so much to everyone who
There's
has
a question in
contributed
the
so far.
chat.
Yeah, we have a question in the chat from
Yes.
Amal. Can you see it? He wants
Yes, I
to.
see.
Okay. Yeah. Okay.
Yes. So thank you for that question. And that's one aspect that is always a long shot of conversation to have. Like, so my understanding of your question is whether some of the problems that are solved have been directly applied in the real world right away. So, not yet. Okay, so I should just put it that way. But what the solutions we focus on is usually to guide. Okay, so I provide this guidance, and somehow it's probably could have been integrated into some decision making processes of some hospitals. They don't need me to uh, interpret these insights. So they can easily deduce the insights because of the way we write in this field. You have to write and provide insight that can readily guide someone who is not a technical expert. So that helps. I don't know if it's possible that someone is using it right away, but we usually have issue in this particular aspect where even if you have a partnership with a hospital to solve a problem for them, hospitals are rigid and they are not really open to changes because changes are really difficult. Okay, so this is the way they do their things, and you are suggesting a way to do it differently, though you are showing that this way is going to bring a good yield for them, but they are looking at it from the point of the stress that they have to go through, some ethical considerations that you might not have put into consideration in your own solution because you are a mathematician. So those aspects are difficult to navigate. So it's one of the issues that we have to deal with, and this sometimes our solutions take time to get direct application in the real world. Yeah.
All right. Thank you so much. This has been a fantastic event. Thank you so much, Dr. Tayo, for the knowledge you've shared. Could we please give him a round of applause with the clapping emoji to celebrate his presence here and all of the knowledge that
Thank
he
you.
has shared?
Thank you, everyone. Thank
Thank
you
you.
so
We
much.
really appreciate your time. I would now be handing over to Dr. Dantu to close the event. And yes, it was a lovely afternoon and morning. And we thank you very much, Dr. Taiwo, for your time.
Thank you so much, Toby.
Thank you so much, Toby. Thanks a lot for that great job of moderating. And thank you once again, our guest speaker, Dr. Taiwo. We are very pleased to have you and to, like just like you said, right? Like in 300 level, we're taking this modeling class, and I was like, hey, I want this math that can relate to real life because, of course, the usual thing is, oh, if you're going applied math, you are doing the lazy man's job. So, well, I mean, I don't think I care, though. So I think there was an era for pure math when maybe the early 1800s or something, they really had all that. But I think now we want to. So, of course, the beautiful thing is that for people that have background in pure maths, when they come into applied maths, they are sounder. So because sometimes people like us that attending FUTA, we did more of applied math. So sometimes we have a bit of deficiency in the pure side of things. But so that's also not to throw away the pure side. So for people who have deep understanding of pure mathematics, when they come to applied and they get a hang of it, it's always very sweet. So I think so. If you have opportunity to learn pure maths too, I think we shouldn't be thrown away. And then come to applied, and then it really makes a lot of sense. So once again, we have 1 minute to go, and I want to make sure of that. So thank you everybody for coming. I acknowledge Dr. Kayode Oshinubi, he's in charge of BMA research. Thank you for being here, Dr. Kazima Kone. Thank you for always bringing up these very insightful questions. God bless you. Thank you, everybody, for attending. Our next webinar will be next quarter. And thankfully, through Dr. Kayode's connection, we are going to be talking about AI and all of these things. So it's going to be very nice. So just watch out for the date. So see you then. Thank you once more, Dr. Taiwo. Thank you, Toby, for moderating. We are very grateful. See you. So for those who came late, we are going to have this on our YouTube page, so you can always have access to it. And once it's uploaded, we'll also share with our guest speaker. Thanks a lot. We are very, very grateful. Bye.
Thank you.
Yeah.
Bye.
Thank you.